Hello, dear doctors, nurses, medical students, and healthcare team. How are you today? I hope you are well. Here we are going to talk about another cardiology question. Okay, a 58-year-old woman presents to the accident and emergency with a complaint of fall. Her medical records reveal that she has been in attendance to accident and emergency quite frequently over the last few months because of recurrent falls. On examination, she looks slightly pale and she jokes that she is clumsy nowadays. Her past medical history includes asthma, hypertension, and a previous myocardial infarction 3 years ago. She is on a salbutamol inhaler, a beclomethasone inhaler, amlodipine, aspirin, atenolol, and benroflumethiazide. What is the single most appropriate investigation to be carried out for this patient? A. 24 hours ECG. B. Blood pressure monitoring. C. Peak flow meter. D. Echocardiogram. E. Computerized tomography overhead. As we can see in the patient's history, she has the history of cardiac MRI or the history of hypertension, and she is on multiple antihypertensive drugs like amlodipine, atenolol, and benroflumethiazide, and blood pressure monitoring is the best choice here. Here we are going to explain it. Okay, explanation. Her regular medications include multiple blood pressure lowering agents such amlodipine, atenolol, and benroflumethiazide, which are known to cause postural hypotension. Blood pressure monitoring would be appropriate in this scenario to assess and review her medication therapy. Okay, postural hypotension or orthostatic hypotension. Postural hypotension should always be considered in elderly patients, especially if they are on multiple medications and present with dizziness. The baroreflex mechanisms, which control heart rate and vascular resistance, decline with age, particularly in patients with hypertension, who thus display lability in BP or blood pressure. They are particularly prone to postural hypotension and to the effect of drugs. It may present with dizziness or sudden loss of consciousness after getting up from a chair, with recovery within a minute. Diagnosis of postural hypotension or orthostatic hypotension is blood pressure taking when lying down and standing up. If postural hypotension is defined as a drop in BP of more than 20 mm after 3 minutes of standing. Okay, we must say this note that one of the most common cause of postural hypotension is dehydration, especially in elderly men and children. It's dehydration. This is the reason that urine electrolytes are always requested if one presents to the hospital with collapse, with the likely reason being postural hypotension. A raised creatinine and urine would support dehydration. Hydration using intravenous fluids would be key if dehydration is the cause, and it was an important note to explain. And here is some golden points for dizziness. Okay, if the patient is dizzy when rolling out of the bed, benign paroxysmal positional vertigo is the most likely cause. Light sensitivity during dizzy spells, migraine headache is the most likely cause. Fast attack, severe vertigo lasting hours with vomiting, we must think about vestibular neuritis. Light-headed when getting up from the bed, we must think about orthostatic hypotension. One ear feels full before or during a dizzy attack. many years the disease is the most likely cause. Here was the short explanation about the patients coming with disease, which their common cause is orthostatic hypotension, especially in elderly patients which are on multiple antihypertensive, antihypertension drugs. Thank you for your attention.